Good afternoon, Nompu. Well, as you've just said, that in that briefing that we carried out as the SABC News earlier today, where the Minister of Health, Dr. Joe Phaahla, actually confirmed to the media that the current numbers at his disposal was that 4 people had passed on due to the ongoing, maybe, likely, these are the words he uses, to the ongoing NEHAWU strike. Of course, he could not categorically confirm this and says that information is still coming through. However, that already tells us about the intensity of the strike and the importance of the public health sector if there are no staff to be working. The CEO of Charlotte Maxeke Hospital earlier on, she also gave a detailed breakdown about just how much they were impacted, giving us an idea that at some point they had to use interns to be able to keep things going. At pharmacies, they had to turn back staff. 61 elective surgeries had to be cancelled. This just gives you only a glimpse of what has been happening and the impact that the strike that now NEHAWU has been having countrywide. I may maybe just take some time to remind you about why NEHAWU is striking. It's part of the public service wage demands. They are looking for 10%, and currently the employer is only offering 4.7%. What we do know now currently, Nompu, is that at this hour, 12 o'clock, the NEHAWU leadership is currently at the PSBC offices. This is the Public Sector Bargaining Council offices in Centurion, where they are meeting with the employer, and we will know this afternoon if this meeting will yield any results. But what has happened earlier on at the Charlotte Maxeke where I was is that the group that was demonstrating there, they decided to disband and dispatch and go back home, and they said that they would come back tomorrow at 6 o'clock. They would meet there, and in the little that I heard in their discussions, they talked about there may be something coming out this afternoon, which indicated to me that this meeting that is currently being held in Centurion could give us a clearer direction of where the strike is headed. Currently, Nompu, I am at Helen Joseph Hospital. These are one of the hospitals where obviously the workers were also picketing. The picture is quite different here because the workers have not disbanded as per their colleagues at Charlotte Maxeke. They are here, and I've asked one of Mr. Baloyi, one of their chairperson here, to chat to us and perhaps confirm. Mr. Baloyi, thank you so much for your time. Confirm that that meeting is currently taking place in Centurion, and what you are hoping to get out of that meeting. Welcome to SABC News.
Thank you very much, and the viewers at home, especially the workers of South Africa. Indeed, yes, the union has been called, and we hope that as workers, our government, the employer, is calling us back to the PSABC solely for 2022. Because we're not going to entertain any negotiation for 2023 because we're on a deadlock with government for 2022 because government have given or have implemented their offer without any resolution, without any agreement from all the unions, of which that we view that as an undermining of the collective bargaining. So we're not going to entertain anything for 2023. We hope in the PSABC today, as government have called us back to the table, it is about 2022. Yeah.
Mr. Baloyi, let's take off the hat of unionists for a while and put on the hat of the fact that you are a worker, you are also a parent, I'm assuming, and that you also have to contend with the cost of living like the rest of us do. Please take us into your confidence about how your members are impacted by the current economic conditions. Perhaps paint a picture that we as the media may not be aware of.
Very much. I think the workers of South Africa, not particularly public servants, but with public servants as the workers that I represent, it is worse. We are parents. We're given 3% with an inflation that is above 7.8%. That was a salary cut in actual fact. So with the high increases of petrol, food, and everything in South Africa, it is worse. Workers are in the verge of losing their houses, their cars, and everything. So it is bad. We are paying school fees for our children. As you can see in higher education, what is happening there. These are our children. Most of us who don't qualify even for NFSAS. Hence, government, that is part of our demand, that we must have bursaries for our children, because we as government employees, most of us who don't qualify for NSFAS, we are the missing middle that government is talking about. But they are not doing anything. They are not willing to do anything for public servants. Hence, they are saying or referring to us as essential. But in terms of salaries, there's nothing essential.
Your colleagues at Charlotte Maxeke, they decided to put tools down for today, saying that they'll reconvene tomorrow. I see that you are still keeping strong. How long are you planning to be here for?
Yeah, today our strike is continuing. The only thing that we encountered today is an interdict. The interdict is not interdicting the strike. It's interdicting us from disturbing anyone who is coming in and out. So we are going to comply and make sure that we continue picketing, demonstration, because that is very important. As members of NEHAWU, we know our struggle, and we are going to make sure that there is no surrender on that. We are not going to even retreat.
Let's talk about what the minister said to us earlier this morning. I'm not sure if you were watching or listening. He says that currently it looks like about 4 people may have lost their lives due to the ongoing strike. How does it make you feel as a health worker and a person that is encountered and entrusted with the lives of patients?
As workers, obviously it will touch us, because before we become workers, we are community members. We are part of these communities that we are saving. But that particular blame must be put back to the employer, because the employer did the right things. From 2020, the very same employer that is playing role today have reneged from the resolution 1 of 2018 in 2020. In 2021, the very same employer offered what we call gratuity. We kept quiet. The same employer last year forced through our throat 3% that we never agreed it on. So if the employer could have done things differently in the right platform, in the collective bargaining, I don't think South Africa will be facing the situation that we are. So the problem is our government. It's not NEHAWU. It's not the workers. NEHAWU cares about the workers. That is why just last month we launched what we call public service campaign, to make sure that we make an awareness to the communities that we are serving, so that they know the challenges that we are facing as workers that impact on them. There are austerity measures that are implemented by this government. Austerity measures means public budget cut. What does that mean? It cannot impact only on the workers. It impacts on the community also, and the society as a whole.
Thank you so much for your input. I really appreciate it. Nompu, you've heard it for yourself about the impact that the economy has and the fact that government had reneged. I just quickly want to show you of the remnants of what was left from the past 2 days behind me, where the tires had been burned. But currently everything looking like everything is going well. Right now here at Helen Joseph, patients are coming in and out, no disturbances, which means that NEHAWU is indeed complying with the court interdict. But all eyes are on this meeting that is taking place in Centurion today with the employer, to see if a resolution will come out. Interesting diary of the MEC for Health in Gauteng. She'll be going to Begimlangeni Hospital, Baragwana Hospital, Bethakwa Hospital, Telem Khweranes Bukeng, as well as Kopanong Hospital for oversight visit, just to check how things are going. We will be on the story throughout the day and giving you blow-by-blow coverage of what is happening with the strike, with NEHAWU and the talks with government. And it's back to you in studio, Nampu.